The following is a paid program. The content within this program is not endorsed by KRCR or its affiliates. You're watching North State Health, the North State's first local health program.
Good afternoon, I'm Tim Mapes. Thank you for joining us for North State Health, the only show dedicated to bringing you the information you need to live a healthier and happier life. Now, our guests today are the team from Shasta Orthopaedics in Reading. We are starting off with Dr. Paul Schwartz, who is the founder of Shasta Orthopaedics. Dr. Schwartz, welcome. Let's start by you telling us a little bit about your company and how you got started here in the North State.
Well, thanks for inviting us on the show, Tim. We founded Shasta Orthopaedics in 1993 with just one physician, and we've now grown to an 8-physician multi-specialty practice. We service the North State with a comprehensive program for musculoskeletal injuries. We have general orthopedic surgeons, we have spine surgeon, hand surgery, joint replacement. We have a full physical therapy department. We're adding chiropractic services to our repertoire this fall. And we're very excited about the comprehensive musculoskeletal injury services that we provide for Northern California.
All right, that's great. And speaking of excitement, we understand you have some exciting new news recently about a new facility, huh?
Yes, we're moving into our new office. We currently have 3 offices scattered about Reading, and we are coalescing our spine center, our main office, and our physical therapy practice all into one building on Liberty Street. It's a 56,000 square foot facility, and we'll have all of our physician clinical services there, our physical therapy department, our diagnostic imaging services there. We're very excited about moving into this facility.
All right, that sounds wonderful. Dr. Schwartz, one of your particular areas of expertise is knee surgery. Tell us a little bit about that.
Well, as you know, the knee is the largest joint in the body, and it is very prone to injury throughout our life. We have difficulties with this joint as youngsters and as adults both.
Okay, now who is the most prone to having problems with their knees?
In younger folks, we have a lot of athletic injuries in the knee. Women tend to have more knee injuries than men, and as we age, we get into difficulties with joint replacement surgery because of arthritic conditions of the knee.
Okay, we saw who are the most prone to it. Who are the most, or what are the most common problems that people do have with their knees? And I believe we have a graphic for that as well.
Yes. Well, in athletes, we have meniscal injuries and damage to the cartilage surface, which generates wear and tear in the knee, and also problems with the patella.
All right, let's start talking right off the bat, reconstruction for younger adults. I guess there is a difference between when you have to treat an adult and then someone who may be a little older.
Yes, well, I brought along a model of the knee, and this shows the joint surface cartilage of the knee, the meniscus, and ligaments of the knee. And in younger athletes, we are often doing biologic reconstruction of both the ligaments and the meniscus, and we have some techniques for replacing joint surface cartilage for focal joint surface injuries in a young athlete.
Okay, for a young athlete, one question that I have looking at that, when you deal with a younger athlete, would it be more of like an injury, like a sports injury, and when it's a elderly person or somebody more advanced in age, it's more wear and tear, or?
That's a good generalization, although we see a significant number of athletic injuries in older people now, people in their 50s and 60s and 70s still continuing with athletics, running and exercise do sometimes get athletic injuries as well. However, for the most part, when we get into our 70s and 80s, we're dealing mostly with degenerative problems and reconstructive surgery.
Okay, you were also going to talk about replacements for older adults. There's a difference, and you have some examples of that.
There is, and one of the things that we're quite proud of is our technology and expertise with knee replacement surgery. This is an example of an artificial knee joint. As you can see, it's a metal and plastic reconstruction, and getting a good success with this requires good technique in surgical implantation, requires good rehab on the part of the patient. But one of the things that we do is we use computer navigation, and I brought along an example of this. We basically set up a miniature GPS array on the field, and this device, compared with a computer, allows us to precisely position the knee joint so that we get optimum function and optimum longevity of that joint replacement.
All right. Well, thank you, Dr. Schwartz. Well, we still have a lot of information to get to here on NorthState Health. Be sure to stay with us. And for more information on today's topic or any edition of NorthState Health, go to our website at krcrtv.com/NorthState Health. You can watch today's episode in its entirety from your computer or laptop. Yeah, and then that'll be your one shot. When we're on the two shot, go ahead and just talk to me.
Okay.
And he'll kind of point to the camera when it gets up to a one shot, and then you'll want to talk to the camera.
Okay.
And then it'll go back. But people can't see like right here, so sometimes I've noticed if you're still looking at me on a two shot, I'll just like go like that.
Okay.
To let you know to look at that one.
Gotcha.
So
Gotcha.
we ought to be pretty good. And people realize.
Realize I'm not a professional.
Yeah.
I'm
That's okay. Neither am I after a year.
So should I keep my hands up or down or?
Doesn't matter.
Doesn't matter. Okay.
Whatever's comfortable.
Okay. Just try not to slouch.
All right.
Mic check.
Just say your name, spell it.
Steve Ferraro, Ferraro. 1, 2, 3, 4, 5. Check, check.
Do you want Steven or Steve?
You could say Steven. That'd be fine. That's
Steven.
kind of my official title on my card. And all
Steven.
that. Steven.
Is fine. Yeah.
Ferraro. Yeah.
Welcome back to North State Health, the North State's first local health program.
And welcome back. Let's bring in Dr. Stephen Ferraro, a hand specialist at Shasta Orthopaedics in Reading. We understand that people often wait, we're going to get right into it, right into the topic. We understand that people often wait for several years when they start to feel the symptoms, huh?
Well, that's true, Tim. Commonly I get people who have symptoms for years and years at a time, and they sort of put up with it until it gets to the point where they just can't put up with it anymore, and so that's when they decide to get help.
Okay, so what symptoms are we talking about? What type of problems that people are going to be having with their hands?
Okay, with carpal tunnel, typically patients will get numbness in the first 3 digits of the hand. As you can see on the graphic there, there's actually a tunnel that the nerve to the main fingers of the hand, as well as all the tendons to the hand, go through. And it's about 1.5 inches long. And it gets kind of crowded in there, and the nerve gets squished and basically choked off and stops functioning. So people get tingling in the thumb, index, and middle fingers, can get some achiness, some weakness, and actually can get some achiness up the arm as well. And
so those are pretty serious. When you start to feel some of those things, you want to pay attention and at least go get them checked out at the very least, right?
Oh, that's true, because you can actually get some permanent damage if it waits too long. You can lose some muscle function, get permanent weakness in there.
Okay, let's talk about some of these contributing factors to these. What causes these type of symptoms that you're going to start feeling?
Okay, the majority of patients who get carpal tunnel get it because of no reason whatsoever. It just happens. There are factors that can contribute to carpal tunnel: overuse, repetitive use, diabetes, thyroid disease, other medical conditions like that that can affect the functions of your nerves as well.
Okay, let's talk about something called grasping, I guess it is. What is that?
Just hanging on to things. A very common complaint I'll get with people is they're holding onto a glass or something, and then all of a sudden they just notice that it's dropped out of their hands. They didn't notice it, that it was going, until they dropped it. They couldn't feel that they were losing their grip.
Okay, so some of those symptoms are pretty, drastic, it seems. I mean, like we talked about some of the smaller symptoms that people need to pay attention to earlier, but that's something that you think you may really have to go get checked out, huh?
Yes, and again, people seem to not pay attention to it at first because it comes on very, very gradually, and it's only when it gets to the point where it really interferes with their function that they come seek help.
Okay, let's talk about arthritis. That problem. What should people be looking at when they start thinking they may have that? Is that a symptom of all these things?
Arthritis and carpal tunnel are typically different things. One of the most common things I see is arthritis at the bottom of the thumb, or the base of the thumb right in here. And it's something that typically affects women way more than men because they tend to have more ligamentous laxity in their thumbs. And so frequently I'll see patients whose hands look perfectly fine except the thumb, where it's sticking out and it becomes contracted and gets in a little different direction and affects their function.
Okay. We talked right at the top of the segment about, the surgical options, obviously, but there are some non-surgical options as well. So even if somebody comes and, gets checked out and they have some problems, there are some options that maybe they might not have to have surgery?
Sure, and typically when patients come in with any of these conditions, we try to do what we can to avoid surgery. Bracing, therapy, steroid injections, things like that, exercises, to try and avoid surgery when at all possible.
Okay, you were talking about when people have, the problem with their thumb, and I mean, obviously that can, impact their lives if they're into, sports, playing music and stuff like that. But yeah, and you've seen some success stories though, very quickly, that you can treat these problems and they can get back to living their normal lives.
That's true. I have patients who are musicians, for instance, guitarists. They typically have to bring the hand in a flex position like that, and with carpal tunnel syndrome, it's very impossible or virtually impossible for them to do it for a prolonged period of time. And with things like thumb arthritis, piano players need to stretch their hands to get to the keys, and when the thumb is contracted into the palm, it's pretty difficult to do that. And I've had patients who have shied away from teaching piano or playing piano actively, things they love to do, because of this condition.
Okay, we were talking about the thumb, and then also there's something about contracture. What is that?
The most common contracture I see is entity called Dupuytren's contracture, and it's largely an inherited problem where the skin of the hand gets quite thick and starts drawing in the fingers. And I'll see patients who have a little bit, and I'll see patients who have it all the way down. And typically it runs in families, typically on the male side of the family, but we see it in women too.
Okay, so bottom line is there is help out there if people need it.
Yes, there is. There is surgical excision to straighten out the fingers. There's also some newer things out where there's injectables in there that you can put in there, will help melt that tissue that you can manipulate and try and avoid a big surgery to straighten the hand out.
All right, thank you, Dr. Ferrari. We have much more still to come. North State Health will be right back. You need to move to your left, I guess, a little bit, and then you'll have to raise your chair a little bit.
Compensate for the Ferraro duck.
There you go. It's difficult with me because I'm obviously short too.
Yeah, are you switching mics back and forth?
Yeah.
Can I get a quick mic check?
1, 2, 3, 4, 5, 6. Shasta Orthopaedics rocks. Well, we're advertising North State Health. We might as well.
So we'll come out to the two shot.
So there will be no open, and it'll just come out.
I don't know what you mean by that.
Introduce you.
I'll hear the intro and I'll know we're rolling.
Yeah, there was
right?
like a little music and graphic
Oh.
thing, and this time it's when we're up, we'll be on a two shot. So it'll
Okay.
just be us. So, and I'll just interview or introduce you right off the bat.
Great.
So
All right, you guys ready?
I. And welcome back. Joining us now is Dr. John Lange. He is an ankle specialist at Shasta Orthopaedics. We just talked with Dr. Ferraro about the hands, but you're going to talk about ankle injuries, right?
True. The the ankle is a highly loaded joint that has a relatively small joint surface area, and so it's unique in the human body.
Okay. What type of problems do people get with their ankles? I mean, obviously there can be severe and less severe, but I mean, go ahead and run us through those.
Certainly. Younger people have issues with instability. They can have recurrent ankle sprain injuries, and they can also have fractures that happen when they're doing athletic activities or just accidentally walking along and twist their ankle. And ongoing ankle sprain injuries or instability or post-traumatic arthritis can happen as a result of the fractures. And that can lead to them getting degenerative joint disease or a worn out ankle.
Okay, so when people start having these problems with their ankles, let's talk about the different treatments.
Okay, so as Dr. Ferraro said with the hand, we start off with non-surgical treatments with injections and bracing and even surgeries to reconstruct the ankle ligaments when that's appropriate. And when it's not appropriate, when the ankle's sort of worn out and you get to end-stage ankle arthritis, then there are a couple of operations. Traditionally, we've done ankle fusions, which is to take the motion out of the ankle joint and make the two bones grow together. And we have more recently had better success with ankle replacement surgery.
Okay. Tell us a little bit about how the treatments have changed over time. Luckily, I mean, obviously as medicine gets a lot better, I mean, the treatments are a lot better. So tell us how things have changed recently.
Good. So one of the big changes that's happened in ankle replacement surgery is that we finally figured out how to do it. Back in the 70s, we started doing ankle replacements and they had really pretty uniformly bad results. And so when I did my orthopedic training, we were taught basically never do an ankle replacement, just always do a fusion. And in the last 5 or 10 years, quality ankle replacements that give good long-term results have come out. And we're very excited about that because a fusion takes all the motion in the ankle joint away, and an ankle replacement retains usually about half the motion, not all the motion. But what that does is it protects the other joints in the foot. The adjacent joints don't have to do extra work because of the fusion of the ankle. And so the rest of the person's foot winds up doing better with the ankle replacement.
Okay. We want to talk about some success stories a little bit. I mean, you've seen the ankle replacement and this and that, but obviously, I mean, people can have these treatments, and you said you have seen some people in some pretty short order be able to get back to some pretty regular life activities that they want to do.
That's correct. The ankle fractures, we routinely treat routine ankle fractures, the most common ones, with surgery to put the bones back in place, and those typically heal within about 6 weeks. And we have patients weight bearing within about 4 weeks, and at about 3 to 6 months, they're back to their previous activity 90% of the time. It's not a 100% guarantee, but most of the time they do very well.
Yeah, so definitely there is a, you know, a chance to go ahead and, you know, heal very quickly. So it's like, it's not something that's a lot of time. I mean, I think that's just amazing.
Correct. We've also seen some improvements in fracture treatment in patients that are older. And we're very excited about that because as the population is aging and staying healthy and active longer, we're seeing athletic activities in older patients and athletic injuries in older patients. And so we've developed in the last 10 years a technology called locking plate technology. And those locking plates allow us to take bone that's perhaps osteoporotic, that's a little bit softer than it was because the patient's older, and use the locking plate technology to get the good results in older patients that we have been getting in younger patients for a long time.
Okay. At what point should people come in and you know, get evaluated at least? I mean, are there some symptoms that people can look at? Obviously pain, but I mean, what is normal and what isn't normal? When should they come and see you?
Correct. Typically, pain that exists for more than just a few days. You know, anybody can wake up with a sore ankle, and 2 days later it's okay, and that probably doesn't need to be treated by a doctor. The ongoing problems, especially functional problems, the limitation, how far you can walk, how long you can stand, that type of thing, really ought to be evaluated. Some kind of subtle problems can turn out to be very serious if they're not treated, especially long term.
All right, thank you very much, Dr. Lange. We are not done yet. There is still much more to come here on NorthState Health. Does
Or
it say-
you just say neck. I mean, I don't know. Yeah, neck is probably fine.
problems, types of neck?
And then we're not going to talk about those two. Those were taken off.
Okay, so what are we talking about? Because I just looked at this, so.
All right, so these two,
Mm-hmm.
and then I would just want to make sure, Dr. Jones, then this part right here.
Yeah, and if we have time, you know, I can give a couple examples of, you know, return back to function and, you know.
Do you want to keep this?
Yeah,
Ken?
let's go
Okay.
ahead and do that.
Let's make sure we're, yeah. And then I'll tell Carrie that we're using the graphics for the first two.
What's the graphic, what's the first one they have? Because I think it said
What's
lower
the
back.
what?
The first graphic, I think, says lower back pain on it, unless they changed that.
Can we get a mic check real quick?
Sure.
Just,
Brad Jones, 1, 2,
Yeah,
3,
see.
4. Yeah.
Yeah, so we're not gonna do that
Yeah.
graphic. So we need to figure out what we're,
They're taking it out.
But you guys can splice that in later, right? I mean, another graphic.
I don't know. I don't think we can. I think we're just recording it how we,
Oh.
how we do it. Mic check again.
Brad Jones, 1, 2, 3, 4, 5.
A little bit more.
Brad Jones, 1, 2, 3, 4, 5. Shasta Orthopaedics and Sports
that's
Medicine.
so,
Thank you.
Welcome back to North State Health, the North State's first local health program.
And welcome back. We have been talking with the team from Shasta Orthopaedics. Joining us now is Dr. Brad Jones to talk about some neck pain. Tell us about the different types of neck problems that people can have.
You know, the most common neck problem we see in terms of treatment is actually a herniated disc that's pressing on the spinal cord or a nerve root, causing arm pain, and actually some of the things that Dr. Ferraro talked about as well can often mimic with the carpal tunnel symptoms actually a neck problem as well. And so the most common thing we see, again, is just arthritis of the spine that results in having problems for patients that they end up coming and see a physician for.
Okay, can you explain exactly the cervical spine for us?
Sure, Tim.
Explain the whole thing.
The cervical spine, just in a nutshell, is the top part of the spine between the head and the shoulders. And there's 7 bones that make up the cervical spine, and it provides motion. And it's a very unsupported structure that is very prone to injuries, both in the younger population as well as the older population, from car accidents to sporting injuries to just run-of-the-mill degenerative problems that result in long-term deficits from a neurologic standpoint.
Okay, talk about some of the most common injuries and problems that you see from young and old.
The most common thing we see in the young patient is typically a neck strain, and this is essentially where they have either a whiplash injury or a sporting event that sort of tweaks their neck in the wrong direction. They have isolated neck pain. The next sort of segment would be a situation where a patient has arm pain associated with the neck pain, and that usually results in numbness, tingling, sometimes some clumsiness in the hands, and pain. And that is usually the result of a disc herniation that is pressing on the spinal nerve, causing those symptoms. And sort of the last stage is where the arthritis sort of kicks in, and that's where essentially you have bone spurs that press upon the spinal cord that provide sensation to both your upper extremities, your arms and your legs, and this can cause clumsiness in the hands and difficulty walking that often is thought to be another problem, such as a hip problem or a hand problem. And so often those patients, especially the elderly population, there's a huge delay often in treatment from this particular problem.
Okay, we talked about with some of the other doctors about when you should exactly seek treatment. I mean, everybody can wake up and have a stiff neck or something like that, but what are some of the top symptoms people should be aware of that indicate that it's a problem that they should come see you?
Anything that lasts longer than 6 weeks. Typically 6 weeks is our sort of cutoff. At that point, if the symptoms have not resolved, whether it's numbness or tingling, they should go see someone about that. Usually you start with your family practice doctor, and there may be some physical therapy that can be offered, some anti-inflammatories such as ibuprofen can help. And then if there is numbness and tingling that persists, despite that, that's when you need to have advanced studies such as an MRI to really look at what the problem is. So, and that's typically when you need to see a surgeon when there is a found problem on the MRIs.
Okay, so obviously a big part of this show, there is help out there. So people they have these problems. If you're describing some of the symptoms that they have, there are success stories. Share with us some of those.
Absolutely. That's one of the things that we really want to focus in on when we do surgery is return to function, and whether it is return back to work or in most cases it's just having return back to normal life. We have taken care of a number of patients over the years that have gone back on to working after about 4 years or so of not working. They finally get fixed and they're back to work within 6 months. What I like the most though is the sort of the functional return back to sporting activities. I've got this one guy who 9 months after surgery, I've got a picture of him in my office, 6 feet high on a wakeboard, waving to the camera, and things like that are the true success, is returning back to normal function.
Okay, so yeah, this is definitely not like you go get treatment and then your life is still forever changed because you're debilitated a little bit. I mean, you were talking, people go back and everybody talks about working out CrossFit.
Yep.
I mean, that's, you have to be in shape and in good shape to do that, huh?
You do, and that's, now not everyone, as Dr. Lange indicated earlier, is 100% success. We obviously, if you have surgery, we're changing your anatomy, and there's going to be some issues post-op. But if you do the right things and you follow the right course after surgery, that's when I like to see patients getting back to doing competitive athletics. And you mentioned CrossFit as an example. CrossFit is a very competitive sport, and I've got one athlete that we took care of that she's back competing on state and national levels at this point after fusing her neck. And so those are the true success stories.
Okay, I believe quickly we do have some of the treatment options that people can look at when they start having some neck pain, and we can go through theirs really quick.
Sure. The most basic, obviously, is first is the rest, ice, heat, and massage therapy can help. Anti-inflammatories or some of the medications. Physical therapy and bracing is also very important, as well as lifestyle changes in terms of reducing some of the stress and wear. And obviously the last choice in any of this should be surgery.
All right. Well, thank you very much, Dr. Jones. That's about it for this edition of NorthState Health. We are going to take a quick break and wrap up with today's guest. Stay with us. They have to.
Yeah, we don't have mics.
No, we need mics.
Alright.
Okay. I'm gonna thank you guys for being here, and we'll be talking about, you can, contact them at their new facility, in downtown Reading,
Thanks, man.
across from Mary's Pizza Shack is what she put, but we understand the
Okay.
entrance is a bit tricky, so explain, that type of thing, I guess.
3 and 4, yes.
Entrance is a bit tricky. We want to
You have to
explain.
get
We
around
really want to do that. Coming off the east side of town, you just come right off the highway and turn
Yeah,
right.
you just say
on
off
Liberty-
44.
on Liberty.
You can just say off 44.
Coming from the west side of town, you come
Okay.
down closer to Continental. You can just say right off 44 on
Okay.
Liberty Street.
Okay,
Yeah.
so she said we
Directly
don't have to do
across
that
the-
then, since
oh,
it's
okay.
not that. We can just say the new building in downtown Reading across from Mary's Pizza Shack.
Sure,
I'll say that.
on Highway
And then,
44.
are we gonna run the video again? Okay, and then we can run the video again, and you guys can say, yeah, this is where it's at, da-da-da-da-da, just another.
You do the talking, man,
Yeah.
since you're the senior guy.
I don't know where Haley is. She's not in this.
How long is this segment?
Like 2 minutes total. But
Okay.
I mean, and I have some stuff to say, so it'll end up being like a minute.
Okay.
And he'll be counting down like da-da-da-da-da, so.
Okay. All right.
Okay, so
Oh,
so it looks like Ferraro's coming back. Wait. 1 second. Looks like he's not coming back.
Oh, yeah. We're fine.
See, I had to say Dr. Ferraro's name in the third segment again because at the very end
You
I
said
called him
Ferrari.
Dr. Ferrari.
Yeah, I heard that too, man.
Oh.
It's okay. It's not like he hasn't heard it before.
Yeah.
Okay.
Alright. So we will have 2 minutes total on air. Alright. Is that alright for my wide? Do you guys like my wide? Do you guys, well, do you want, I have 2 chairs if you want them to sit. Got it. I've got 2 chairs in here. We'll put.
The old guy needs the back.
They're going more smooth though. The shows are going, they keep getting progressively.
Really good. They all spoke
Yeah.
very well. I know. Oh, yeah. Oh, yeah. I mean, I wasn't worried.
You were worried. She was worried.
Well, I know how great Brad is. He took care of it.
Are we going to be here first?
Yeah, we'll start on 2. Or start on 3.
Okay.
2 minutes total time coming back.
Well, thank you for joining us for NorthState Health. Join us each week at this time for another edition of our show. For more information on our program, go to krcrtv.com/NorthState Health. There you will find information on all of our doctors, tips from the experts, and you can watch entire shows from your computer. Again, I would like to thank the team from Shasta Orthopaedics, Dr. Schwartz, Dr. Ferraro, Lange, and Jones. We have 2 of them here with us. And don't forget, you can catch them at their new office. Thank you very much for being here today and being very informative for us on these different injuries. But tell us about the new office.
Again, the new office is located just off of Highway 44, almost directly across from the Manu Mary's Pizza Shack location on Liberty Street. And we're very excited to be moving in there next week. And look forward to having people come in to see our new facility.
Oh, yeah.
Oh, sorry, we gotta restart.
Yeah, okay, that was bad. That was bad. It's not going to be next week because we're already there by the time this airs.
Yeah. You caught it, though. Great.
That's what stopped.
Well, thank you for joining us for NorthState Health. Join us each week at this same time for another edition of our show. For more information on our program, you can go to krcrtv.com/NorthState Health. There you will find information on all of our doctors, tips from the experts, and you can also watch entire shows from your computer. Again, I would like to thank the team from Shasta Orthopaedics. Here with me are Drs. Schwartz and Jones, along with Drs. Ferraro and Lange, who you saw earlier. Don't forget, you can catch them at their new office. Tell us a little bit about it. We have some video, and you can give us a little tour as we wrap things up today.
Well, we're really happy to be in our new facility just off of Highway 44. Almost directly across from the new Mary's Pizza Shack location in downtown Reading. Come and see us. We have a very comprehensive program for all musculoskeletal injuries, and really excited about our new location.
Okay, and obviously you can, when people go there, having all of these services in one state-of-the-art spot is really going to help the patients, right?
We really feel that it's an important offering for the NorthState. Being able to offer full physician services, diagnostic imaging, MRI scan, physical therapy, all in one location for comprehensive musculoskeletal care for NorthState patients.
Okay, obviously we just want everybody to know that the help is out there in case everybody is having some problems. We had the symptoms that you guys talked about, which were great, which allowed people to realize that what they should look for when they should come see you guys, and make sure that they can get along, you know, with their regular lives as quickly as possible. I want to thank you guys again for showing up and giving us some great information. We appreciate it.
Thank you very much.
All right, see you next time.